Hello, friends and colleagues. It's difficult to believe that a whole year has passed since we celebrated the 200th birthday of Florence Nightingale in what was then the 2020 celebrated year of the nurse and midwife. As a world, and specifically as a profession, we have faced enormous challenge in our efforts to deal with the current pandemic and its devastating consequences. The impact on perioperative nurses has been far-reaching, I'm aware, on our health and well-being and on our mortality in too many instances. With our extensive transferable skill set, perioperative nurses have been required to meet the needs of our patients in many other disciplines of practice. I have spoken to many who have been deployed to work in accident and emergency and intensive care and in other areas of practice throughout the healthcare setting. Nursing is the most inspiring and fulfilling career ever created. That's what I believe. We have given up to a life that is constant in its demand. And we know firsthand that this is absolutely true for nurses and practitioners who work within the operating theatre setting. Throughout the pandemic, the magnitude of our work as nurses cannot be overestimated, particularly now where many lives are devastated and the hopes and dreams of people are on hold. As nurses, we stand for care, for compassion, with expertise and a reassuring voice of support as we navigate our way back to a better world. We are a profession with a mission. We are important and we are needed. The International Council of Nursing definition of nursing is really powerful and informative. It's something that I love to share whenever I get the opportunity, because it describes who we are and what we do, or at least elements of those of who we are and what we do. You know, we provide autonomous and collaborative care to people of all ages, in families and communities. We administer to the sick and the well in all settings, from birth to death. We are involved in health promotion, the prevention of illness, care of the disabled and dying people, advocacy, the promotion of a safe environment, research, shaping healthcare policy both nationally and internationally, and education. And these are just so many, there are so many subsections underneath all of these headings that I've just outlined, which are part of ICN's definition of nursing. I know that perioperative nursing is not for the faint-hearted. I've been a theatre nurse for many, many decades, and that it's a demanding and relentless job working in the operating theatre. I know that colleagues are tired and overwrought, and not just with the additional challenges of COVID-19. I stand in solidarity, support and understanding with my colleagues all over the world. I know that there are many reasons to be disillusioned, and many of you feel sad and unsupported. There are many in our profession today who acutely feel that there's a large gap between the rhetoric of politicians and world leaders about the value and status of the nursing profession. Last year here in the UK, we had a weekly national clapping campaign for health professionals. But when it came to decisions on pay, terms and conditions for nursing, commitment and value recognition was very sadly lacking in that respect. And I know that this is the experience of nursing colleagues in many other parts of the world as well. We want to be supported by people who walk the walk and don't just talk the talk. And we deserve that support. Nurses have been there to respond to the demands and challenges of the pandemic situation, and need to be there to enable our healthcare systems and our healthcare communities to address the massive growing backlog of healthcare issues, long waiting lists for surgery, etc., as millions and millions of people all over the world wait for hospital treatments that have previously been postponed or cancelled. There's a worldwide shortage within our profession. Currently, 6 million shortage of nurses, and this is predicted to rise to 10 million by 2030. You know, that's less than a decade away, and a frightening statistic, I feel. I want to encourage you as presidents within your organisations to use your influence and power to identify the role and purpose of perioperative nursing, hold steadfast, and to be the voice that leads and supports nurses and perioperative practitioners from the grassroots upwards.